Well, glad to welcome you to the Lupus Foundation of America Chapter Network's Let's Talk About It webinar series. Each month, our chapter network will be presenting webinars on important topics related to lupus from experts across the country. Tonight, we will be discussing lupus and hair disorders. My name is Amy Yonder, and I'm the president and CEO of the Lupus Foundation of America Heartland Chapter. We're headquartered in St. Louis, and we serve Missouri, Southern Illinois, Central Illinois, and Kansas. Before I introduce our speaker, I want to remind you that the information provided in this webinar is for general information and educational purposes only and is not a substitute for your own physician's advice. The views expressed by our webinar presenters are those of the presenter and not necessarily those of the Lupus Foundation of America. If you have questions during this webinar, please type them in the Q&A section at the bottom of your screen, and our presenter will try to answer as many questions as possible after her presentation. You can also chat with others in our chat section. If you have further questions or you want to learn more about upcoming education programs, support groups, or events in your area, please reach out to your local chapter. So now I'm pleased to introduce our presenter this evening, Dr. Amy McMichael. Dr. McMichael is a Philadelphia native who received her medical degree from the University of Pennsylvania School of Medicine. She completed internship at Thomas Jefferson University Hospital in Philadelphia and her dermatology residency training at the University of Michigan School of Medicine. Dr. McMichael has been a faculty member at Wake Forest Baptist Medical Center since 1994. She's currently professor and chair of the Department of Dermatology at Wake Forest School of Medicine. She also served as the residency director at the department for 12 years. Dr. McMichael's clinical and research interests include hair and scalp disorders and skin of color. She is a fellow of the American Academy of Dermatology and a past chair of the Skin Color Society and the National Medical Association Dermatology Section. We're pleased to have Dr. McMichael join us this evening, and I'm going to turn it over to her now.
Thank you so much, Amy. I really appreciate the warm welcome, and welcome to all of you guys today. I'm going to share my screen with you, and hopefully this will work. Everybody's seeing everything. Let's see. Let's go to the actual first slide, and all right, here we go. So Amy, give me a shout if we are running out of time or we have any issues. So as Amy said, I am from Wake Forest. I have had a hair disorders clinic at Wake Forest for the last 27 years, and I've seen pretty much everything that you can imagine that has to do with hair on the scalp, face, body, you name it. I've even seen hair in the throat after surgery. So I've seen it wherever it exists. So there's very little that surprises me. So hopefully I'll be able to share a few of my pearls today with you. I think lupus is a very complicated disorder. So, I'll try to keep it simple, and we can go a little bit more complicated in the questions. Here is my disclosure and conflicts of interest. I do a lot of consulting and a lot of clinical trials. And so anybody who's interested in hair disorders, I'm happy to talk to them. So this is a group of people that I work with. I don't think there's much in this talk today that will be problematic. So, what is this idea of hair loss in lupus? Well, the first thing to know about it is that it can look like many things. You can have what we call both scarring and non-scarring form of hair loss in lupus. And when we talk about scarring or non-scarring, what we're really talking about is the hair follicles are either there or they're not there. And when they're not there, that's the scarring, okay? And usually what happens is white blood cells come up and attack the hair follicles and kill them off. And that's when we get the scarring form of hair loss. The non-scarring forms of hair loss can happen for a number of reasons, and we'll sort of go over those as we go through the talk. So those are the two main sort of pillars, non-scarring and scarring. And the reason why we have those as pillars is because they really are treated differently, and they're very different entities. So in terms of the non-scarring forms of hair loss, if you're talking about somebody who has known systemic lupus erythematosus, and now of course we all know, and I'm not reviewing lupus tonight because that's not my role here, that lupus can be systemic. You can have just cutaneous disease, or you can have both. When you're talking about systemic lupus, there have been several patterns, clinical patterns that have been seen. And one of my very dear mentees or fellows actually wrote the most recent paper looking at hair loss patterns in systemic lupus, and it can include diffuse, that means all over the scalp, hair loss, patchy hair loss, so it's kind of, just as it sounds like, patches of areas which are affected in the scalp, and what they call lupus hair. In other words, hairs that just don't look quite right when you look at them under a significant power of magnification. The other thing that we can see, and this may get to a little bit of the diffuse loss, is that we can see telogen effluvium with systemic flares. So what is that? Well, when we have flares of lupus, everybody knows what that is, right? That's when your body may have been just kind of going along normally, and all of a sudden your joints start to hurt, or you start to have some renal issues or complications, any kind of flare that your rheumatologist, your primary care doctor, your whoever takes care of you for your lupus, any kind of flare that occurs can set your body into sort of a stress mode. It's not like stressful, I had a bad day yesterday, or I've been in a pandemic for 6 months or a year. It's more like, okay, my body's trying to deal with a very significant problem, and it's diverting a lot of energy into this issue. And what happens is hair that grows on the scalp takes a great deal of energy. So when something else is going on in the body and you have to divert energy, it goes right to the scalp. It says, okay, we don't have to have hair, so let's divert our energy over to this other issue. And you'll see this thing called telogen effluvium generally around 2 to 3 months after some big systemic issue. And in this case, it would be a systemic lupus flare. You can have localized hair loss, this shedding around what we call a discoid lesion. We'll see some examples of that in a moment. And you can have alopecia areata, true alopecia areata in patients with lupus, because, of course, we know that patients with alopecia areata and lupus can be one and the same. Because people who have autoimmune diseases can sometimes have more than one, or you can have these sort of patchy areas that look a lot like alopecia areata, but really biopsy out more as lupus. And then, of course, you can have the typical scarring discoid lesions of lupus. So let's go through that a little bit. Here's that paper that I was talking about. This is from the Journal of the American Academy of Dermatology, was published in 2019. And this is from my mentee, who is actually in, where is he now? He is in Thailand. He's from Thailand. He came and worked with me for a year. We did a lot of work together. We didn't work on this one together. This is all his own doing. And it's a beautiful paper that looks at what we call trichoscopic findings. In other words, we use a magnifying lens to look at the skin close up. We use it for moles and melanoma. We also use it a lot in the hair. Some people call it dermatoscope, but we try to use trichoscopic because trichoscopic means magnification of the hair. So tricho means hair. So when you look at the hair shafts, you can see thinning in quite a number of people. You can see oftentimes short regrowing hairs. We see that the hair shafts are not as pigmented as they typically would be in a normal hair. And then if we look at the hair follicles, that's where the opening where the hair actually comes up through the scalp, you can see black dots, which usually means the hair is broken, and you just see a black dot or a white dot. Sometimes white dots are a little hypopigmented. Unfortunately, I don't have a ton of these photos, and they didn't have them in the paper. And sometimes you can see right around the hair follicle a little red dot, which is where there's inflammation and sometimes a little bit of blood vessel collection. And if you look at the skin surface, you can see blue-gray speckle pigmentation. You can see brown honeycomb pigmentation. You can see vessels that are kind of interconnecting. And usually we think of that as sort of a scarring process occurring. And then sometimes you can see thicker vessels. So I'm not trying to tell you this so you can memorize all this and ask your doctor if you have it. But if you go to see a dermatologist and they're sort of wavering, I don't know if this is really lupus or not, this is something that you can do before you get to the biopsy. We almost always do perform a biopsy, but this is something we can do. We can look at it with our magnifying light, and oftentimes we have it attached to a camera. We can even take pictures and put it in the chart and follow progression. So this is something that I like to do because it's not invasive, don't have to cut or numb or anything like that. But if there's really a question of the diagnosis, a biopsy is going to be the way to go. So what clinically do we see? Well, if we're talking about chronic cutaneous lupus, so that's skin lupus, that's sort of a chronic ongoing problem, then we're going to see clinically follicular plugging. That means the hair follicle is plugged. It's almost like if you had a stopper in a bottle and you looked at that little hair follicle, it looks like there's a little stopper in the hair follicle. You often see scaling. You often see hyperpigmentation. In other words, more pigment than should be there. Sometimes you see hypopigmentation and redness. And in this picture, you can see one of my patients that has a partial hair weave that is nicely covering the area. We can just flip it back and allows me to evaluate the area as well as treat the area. And she has significant hypopigmentation. She has hyperpigmentation. And you can barely see, if you follow my cursor, there's a few little areas where there's some follicular plugging. We'll see it a little closer up though in a moment. And you may or may not see this in association with systemic lupus. And of course, if there are systemic signs or symptoms that would, and you only have had up to now skin findings, that then points you into the direction of getting laboratory testing to make sure that there's no systemic problem, look at the rest of the skin, ask about the joints, etc. Because we don't know exactly when people are going to show up with the systemic findings. Typically, you present with that first, and then you're with the systemic findings first, but sometimes not. That's how it goes. Here's another one of my patients. She came in very late, unfortunately, to see me before, so I couldn't really do a lot for her. So this is one of those situations. This was the prior one where we see scarring, so the white blood cells have come up and attacked the hair follicles and basically killed them off. And that's what damages also the pigmentation cells, because when lupus attacks the skin, it does so at the epidermal and dermal junction. So the upper level and the lower level of skin, right where those pigment cells live. And those white blood cells come up and they kind of just have a party and they damage the hair follicles, they damage the pigment cells, and really damage anything they can get their hands on. They damage the blood vessels, etc. So here's a good example of hypopigmentation, a little bit of hyperpigmentation. And down here we see some erythema or redness. Okay, and so this is pretty classic. If you looked at this, you might say, oh, this patient has vitiligo, where you lose your pigment, but she actually has hyperpigmentation and she has redness, and also she has hair loss. And in vitiligo, it doesn't cause hair loss. You don't get redness in vitiligo, and you don't typically get hyperpigmentation. So this is pretty classic for scarring alopecia. So remember, we talked about that plugging that you can sometimes see. Well, this is one of the best pictures I've seen. It's one of my own. I have to pat myself on the back because I don't know how I got this, but you can see there's like a little plug right in those hair follicles. Hair follicles are much bigger than they should be. And there's these little plugs here. Again, you see the hyperpigmentation, not too much hypopigmentation, maybe a little bit. And in this case, you don't see any redness. But what we do see is that there's pretty classic follicular plugging. Doesn't happen to this degree in most other entities. So this should put you in the mind of a chronic cutaneous lesion of lupus. Again, a biopsy is going to be the definitive way to figure this out. And with a biopsy, if you've never had one, we typically numb up a small area and we take about a 4 millimeter punch biopsy. So a little circular biopsy. We usually take two. We take one and we kind of cut it, we bread loaf it, and then we cut the other one the other way so that we can see how far it goes down into the fat. And also we can see what's happening at the top layers. Now, this is one of my patients, bless her heart. She had lupus since she was a child. She unfortunately did not win her battle with lupus, but she and her sister both had lupus. And interestingly, her sister really only had the cutaneous disease. And after she got breast cancer, the sister got breast cancer, she got chemo and her lupus went away. So we were very lucky in that aspect. But unfortunately, this young, beautiful lady had very significant systemic disease. And you can see, that this looks a little different from the others. You can see a little bit of scaling and you can see a little bit of hypopigmentation, but you don't see very much redness. But what you do see is that this ear is involved. Now, there's a few things that can do this, a little hyperpigmentation, scaling, and redness of the ear. One of them is lupus, and one of them is sarcoidosis. So generally, when we see this, it's going to be one of those two aspects or those two conditions. But what she has is these very well demarcated, what we call annular plaque. So what's annular mean? Annular means rounded with a raised border. And that's also very classic for lupus lesions. And she didn't wish to take her hair scarf off that day, but you can see that it extended all the way up into her scalp. And so she covered her head because she had some hair loss with a beautiful scarf. And sometimes she wore wigs and sometimes she wore hats. But this is a very classic kind of finding. And I just wanted to show that classic finding. Here's another one of my patients with that ear finding. I actually just saw this young lady, or she's a middle-aged lady, not too long ago. I see her fairly regularly. And she has that hyperpigmentation and scaling right in what we call the conchal bowl of the ear. So that's like a little cheek area. So if you're not sure, if the doctor's not sure you have it and you have those little bowl involvement, the conchal bowl involvement, that's going to probably be lupus, or like I said, it could be sarcoidosis. And then if you looked in her scalp, she had a pretty well demarcated area of hypopigmentation, still remaining a little bit of erythema. I'm going to show you a little bit more of this lady because I think she's interesting. We got her scalp under control, and I'll talk about, some of the treatments that we used for that. We did topical steroids in her. We did intralesional steroids. That's where we inject the steroid medicine right into the scalp. And we did hydroxychloroquine, which we've heard a lot about this year because of COVID. But of course, that's an anti-malarial that is very commonly used in lupus patients. Got her very cleared up, and we were on our way tapering her off of the hydroxychloroquine because she wished to do that. And she started getting these lesions on her cheeks. And they first looked like acne. And I thought, wow, why is she breaking out with acne? We had not used any steroids, orally. And the injection steroids don't typically cause this, nor do the topical ones. But it was her variant of lupus. And so she had this rare comedonal means acne-like variant of chronic cutaneous lupus. Very few cases, only about 10 cases reported in the literature. And if you have something that looks like a bit like acne, but it's not typical, you want to kind of think about this variant. Now, sometimes you can just have acne and that's okay too. But if it comes and you need to look for other signs of chronic cutaneous lupus, got to rule out systemic lupus, which we have done several times in my patient. Biopsy it, make sure that you know what you're talking about, and again, treat with antimalarials, topical steroids. And we did just that, and she's actually doing quite well. She's even doing a little bit better than this because she is very good about getting her chemical peel. She's been doing all the things cosmetically that we recommended as well as medically, and her skin is clearing up very nicely. Here's another patient of mine that had this, and it was not recognized for a long time because it was thought she had lupus. But if you look very closely, it goes up into the scalp. It was on her ear, and she had those annular plaques, right? Those plaques that are circular with a raised border. So you have to be careful. And I'm showing a lot of patients who have brown skin, and you might ask yourself, well, why is that? Well, part of it is that lupus is more common in African American women. It's the most common group to have it. But certainly men can have lupus. Children can have lupus. Anybody of any ethnicity can have lupus. And as I said, that study that we were quoting was in patients from Thailand. And this is another view of, if you look at all the hair-bearing areas, and her brows, it doesn't affect her forehead, but right where her hairs are in her brows, it affected it, upper lip and chin. Again, something that is a little bit different, but we need to think about it when we see things that don't quite fit our acne profile. So what do we see when we do those biopsies? I was talking about taking the biopsy, we send them off to the pathologist, and what we see is this change. So this, if you can look at my cursor here, this top here from the darker cells up is the epidermis, and this from here to here is the dermis, and then you start getting to the subcutaneous tissue. This is probably a little hair follicle of some sort being attacked. And what you can see is that there's damage to this layer here. You can see that there's white blood cells kind of coming up and trying to attack this layer. And it's hard to see that if you're not used to looking at slides, but we can see that. And you can also see that there's white blood cells down here around probably some of the vasculature. There are white blood cells surrounding that hair follicle. There's also something, this is kind of a blue color. It's kind of a bluish violet, and generally is pink. It's supposed to be very pink, but in skin in lupus patients, oftentimes you'll have a deposit called mucin. It's not always there, but when it is there, it's a good indication that you're dealing with lupus patient or lupus condition, and it causes the stain to look kind of washed out and bluish. And then you can do special treatments of the biopsy. It's called a direct immunofluorescence, and you can measure certain proteins, and if they're there, that also gives you an idea that you're dealing with lupus. So what I'm trying to say is that lupus isn't about just eyeballing the patient. It's about getting the story, evaluating more than just the scalp. Look at the ears, look at the face, look at the area around the ears. Use your dermatoscope, because there are certain findings that we see in those with that, and then move to a biopsy. So that's kind of the progression that we're talking about. Once we've done all that and we've diagnosed you with, chronic cutaneous lupus, first we got to make sure we treat systemic lupus. Now, sometimes our treatments will treat systemic lupus, but I often will treat patients along with rheumatology. That's really my favorite thing to do. So we kind of co-treat. It's easiest if we use the rheumatologist in our medical center, but I can treat with any rheumatologist anywhere, as long as we have a good line of communication. And as I talked about, we often do use intralesional and topical corticosteroids. Now, sometimes we'll pull out our oral corticosteroids for skin lupus, but that's very rare. Typically, oral corticosteroids are reserved for systemic symptoms. We do use a lot of antimalarials though, and that's usually hydroxychloroquine, because that's really the safest, typically most available antimalarial. When I was early on in my training, chloroquine was used a lot more, but it's hard to get that now. Hardly anyone makes it, so we use hydroxychloroquine. And we do sometimes move to other agents. And when we do that, it's usually because the antimalarials are not working. So we use Imuran or azathioprine, methotrexate, and cyclophosphamide. We also use other drugs, oral retinoids. This is like Accutane. Sometimes we'll pull out Accutane because we find in some patients it can be helpful. We also use the anti-leprosy drug Dapsone. We use Dapsone in dermatology a lot because it's an anti-inflammatory treatment. And then we use this other drug called thalidomide. And you might have heard about that many, many years ago when it was first pulled off the market. It came out first as a way to allow pregnant women, or really anybody, to get a good night's sleep. It was kind of a sedative. But unfortunately, no one knew that it also caused fetal damage in developing babies. So it was given to many pregnant women, primarily in Canada, and they ended up having babies with abnormalities. And so it was pulled off the market for a very, very long time. But now it's put back on the market. It was put back on the market some years ago because it's actually a great drug, and it works really, really well in my chronic cutaneous lupus patients. So when I can't use antimalarials, for instance, there's a side effect or complication, or they can't tolerate it, they're allergic, then we can move to thalidomide, and it's now a federally regulated drug in our country, not in other countries, but in our country, in the US. So you have to sign up in the program. This is all to make sure that nobody who's pregnant gets it, or that no one who's on it gets pregnant while they're on it. And it actually can be a very nice drug to use. The only problem is that they've also found that it can work in some cancers. One of them is melanoma, and anytime a drug works for cancer, the price of the drug skyrockets. So it's actually costs pennies in a developing country, and it costs hundreds of thousands or thousands of dollars in the US. So I'm told you that I would talk about these other ways that lupus can look, and we'll spend a little bit of the remainder of our time, so about 5 more, maybe 10 more minutes on ways that lupus can look. And it can look like this thing called telogen effluvium. And you know, people have probably had telogen effluvium. A lot of people in this call have probably had telogen effluvium, and may or may not have been related to your lupus, because telogen effluvium can happen for a lot of different reasons. It's one of the most difficult to diagnose alopecias because it's constantly changing. If you see it in the early phase, you can have all over shedding, have just hair coming out in handfuls. If you see it kind of in the middle phase, it's kind of mild shedding. If you see it in the late phase, you may have very little shedding, and only right here in the temporal scalp, right in the little temporal scalp there, will you have a pull test. But the patient will say, I really feel like my hair is thinned out all over. When I pull my hair back into a ponytail, it's much less, I have to wrap it around more times. But most of the time people do recognize the shedding when it occurs. And we'll talk a little bit about causes. So many of the causes are listed here: starting or stopping medications, like going on or off of oral contraceptives or hormone replacement medications, iron deficiencies, thyroid abnormalities. After having a baby, a lot of people will have this form of shedding about 3 months or so after. Significant weight loss or protein calorie malnutrition. When some of these fad diets come out, we will see people just kind of going crazy with hair loss. There's been telogen effluvium associated with COVID, with actual having the virus, as well as just sort of being stressed, long periods of time during the pandemic. And then lupus flares, of course, primarily talking about systemic lupus flares, and then physiologic stressors like fever, systemic illnesses, surgery, general anesthesia, etc. So it's really a big umbrella. But in the lupus category, if you have lupus, then you may have what looks like this telogen effluvium flare. So we usually take a good history to make sure that's indeed what it is. If we don't have an identifiable event other than the flare that you're talking about, we will check a few labs just to make sure nothing else is awry. But if those labs are normal and it really isn't a flare of your lupus, we might consider nutritional consultation, because everybody thinks they eat really well, but most people don't. So if it is your lupus, then it might be a hint for us to get a better handle on controlling your lupus. Sometimes you'll get a flare, you'll get it under control, but the hair loss will be delayed, about 3 months after. So there's really not much you need to do. You just have to kind of grit your teeth and get through it. And what happens is usually about 6 months in, things start to really calm down. And then 9 months in, everything's stopped in terms of shedding. You're starting to regrow hair, and then by a year, it's much, much better. But it's tough to deal with it when it's happening because it's very scary. But it's one of those non-scarring forms of hair loss. So as long as you get everything under control, you should be able to regrow that hair in those cases. Alopecia areata is an autoimmune disease of the hair follicle. We see it in patchy forms. You can see it down here in a patchy form. Sometimes you can see it in big, large swaths. Sometimes it's in the back. Sometimes it's total scalp. Sometimes it's the whole body. This young lady didn't have any eyebrows or lashes. And it can occur just by itself, obviously, but it can also occur in patients with lupus. If you look down here, and you can see associations with classic autoimmune disorders. Alopecia areata happens in thyroid disease, vitiligo, pernicious anemia, which is like a B12 issue, lupus, diabetes, etc. So alopecia areata comes out sometimes in lupus patients, and it's something that we can treat very aggressively because we know how to treat alopecia areata. Typically, it comes out in a patchy version. And again, sometimes I'll biopsy because I want to see, is it the patchy version of lupus hair loss, or is it truly alopecia areata? Because we're going to treat it a little bit differently. If we see something called exclamation point hairs, if we get a positive pull test, if you get only dark hairs involved and the white hairs stay, that's all signs that it's truly alopecia areata and not lupus. Sometimes the hair will regrow in gray or white. And sometimes we'll see pitting of the nails. Again, signs that it's more alopecia areata rather than that patchy lupus-like hair loss. And we can treat alopecia areata when it's patchy. Now, I have never seen somebody get this kind of severe all over alopecia areata and lupus. And so I don't think that that's typical. I think it's more typical to get the patchy variety that we can actually treat. And treatments will include, again, topical and intralesional steroids. We sometimes will use a systemic steroid. I typically won't use it in a lupus patient unless they're already on it for some reason. We can do topical immunotherapy. I don't typically use this in lupus patients, but we can use MINOXIDIL, and I do use that in lupus patients, so sorry. And we don't typically use anthralin or excimer laser very often. And now there's lots of new things to treat alopecia areata patients. This is sort of the breakdown. We've got these new things called JAK inhibitors, which are not actually approved for use yet in alopecia areata. They're actually approved in rheumatoid arthritis or polycythemia vera, as you can see here. I would not use those in my lupus patients because they are not necessarily approved for use, and they could go against the rest of the medicine that you're taking. So while it's good for alopecia areata patients that just have alopecia areata, or perhaps good for that, we wouldn't use it in a patient with lupus who has alopecia areata. I just want to show you that. And there's lots of studies looking at these new drugs, and there's lots of studies looking at drugs that are completely new, not even out on the market, that are like these so-called JAK inhibitors. Now, oral minoxidil, I actually have to say I have not used in a lupus patient, but it is high on my list of use. You know, back in, 10, 15 years ago, we only thought about minoxidil as a topical. You've heard of Rogaine. That's the generic name of it is minoxidil. So topical minoxidil foam, topical minoxidil solution. And we do use that in our lupus patients if they have hair loss, because all minoxidil knows what to do is to cause your hair to keep growing. It keeps it in the growth phase. But sometimes it can be messy, it can be irritating, itchy. And so people can't tolerate it. We actually have new data out of Australia, this guy down here named Rod Sinclair, who did studies to show, in female pattern hair loss anyway, that low dose minoxidil orally can be helpful for hair growth. So it's something that you could potentially talk to your doctor about if you've had some lupus related hair loss. They may be willing to try it. They may not, depending on what's going on in your hair. And they would certainly want to talk to both your dermatologist and your primary care doctor. Now, I've included platelet-rich plasma because it's out there and people ask me for every form of hair loss, do you think it will work? Again, 0 studies that I could find in lupus for platelet-rich plasma. Let me just tell you what it is briefly, though. It's where we draw your blood, we spin it down, and we take the top layer, which is the plasma layer, and has activated platelets in it, and it's injected back into your scalp. So very natural because it's all your own, parts of your own body. It's used primarily for female male pattern hair loss. Now people are starting to use it for scarring forms of hair loss, but again, I haven't seen it in lupus patients. So while, we are doing it, we need to get some more research on whether or not this is good for our lupus patients. It's very expensive, not covered by insurance, and everybody does it a different way. So right now, I think this is one thing to avoid when you're talking about lupus patients. Now, the final thing I'm just going to mention is centrifugal, cicatricial alopecia. And this is a collage of the various ways that it can look. It's typically on the vertex scalp or the crown of the scalp in women of African descent, but as you can see here, not all the time. And it causes what could look very much like a lupus-related hair loss, not as much with the pigmentation, but you can see some, hypopigmentation in some patients and some hyperpigmentation in some patients have a little redness. So in the case of whether or not this is CCCA, again, forming more in women of color versus lupus, which is also more common in women of color, a biopsy is really indicated if you can't tell the difference. And you can have both. I have patients who have both diseases and we treat both of the diseases. It's common, but not super common we have some prevalence data in South Africa and in the US, typically around ages 30 to 65, but I've seen younger, I've seen older. And we do have some genetic data that both myself and one of my colleagues from South Africa have worked on in this disorder. But again, it can really mimic, sometimes the patchiness of lupus. So want to make sure that we treat the right thing and that we know what we're treating. So I'm going to close this off there because I'm sure there'll be some questions, and just say that hair loss in patients with lupus can look many different ways, and it can be very confusing. Hopefully I've clarified for you some of the ways that it can look and how we determine what you have and how to then go to treat it. You need to see a board certified dermatologist for diagnosis and treatment of this kind of hair loss, because it can be very difficult for your primary doctor or your rheumatologist to figure out on their own. And remember, you can also get all the normal things that everybody else gets: female pattern hair loss, male pattern hair loss, dandruff, and lots of other common things, but it's not necessarily related to your lupus. It's just because you're a person. And rarely do we find that lupus medications cause hair loss. So that's a good thing. We don't typically worry about that. So I'll end there, and thank you for your attention. We have great resources here for the North American Hair Research Society, the Cicatricial Alopecia Research Foundation, and hopefully you also know about the National Alopecia Areata Foundation. And I'm sure that Amy can provide these things for you if you need them. So I'll stop the share and get to questions.
Okay, great. I know we've had some questions. People wondered if you'd be willing to share your slides. Can I get those from you? Or is that not something?
Yeah, not with the pictures. If they don't mind just the words, yeah, I'm happy to do it.
Okay, great. Okay, we do have a lot of questions. So I'm going to start with the people that have posted in the Q&A. I know some people have also posted in chat, so I'll try to get back and forth. But if you've posted a question in chat, if you wouldn't mind putting it in the Q&A, that would help me not have to go back and forth. So one person is just talking about having scalp pain and itching and what can be done about that.
That's really a good question. I didn't cover that because that's a whole, you could talk about scalp pruritus. That's our fancy dermatology word for itching, for 2 or 3 hours. But lupus is one of the things that does cause scalp itching. I've seen it in many, many different things. So again, it could be just your typical seborrheic dermatitis or dandruffy issue, or it could truly be the lupus. And if either way, a good place to start is a nice anti-dandruff shampoo, like one with zinc pyrithione in it. Some people like the prescription ketoconazole shampoo, and those are really for the scalp. Now, the other thing that you can do is the topical corticosteroids that we talked about. You can use those in a variety of ways: solutions, ointments, oils, lotions, whatever works for your hair type. And generally I'll use that for about a month to 2 months and taper it slowly. And if we've gotten good results, then we stop there. If it's localized, because you have localized inflammatory areas, we can do the injections in those spots. So primarily we're going to take down that inflammation that we think is causing the itch.
Okay, great. Is it common for someone with SLE to have their hair turn white at an early age? I think you talked about hair turning white.
Not particularly for lupus, but if they have a version of alopecia areata, that might be the case, or it might just be genetic. You can, when we have a chronic disease, you kind of always try to put everything under that umbrella, but sometimes it just happens because you're related to Aunt Sue or Uncle Joe, and they all turn, white early. So it's not typical, but maybe if it's alopecia areata, you might, yeah.
There were a couple questions, people just concerned that if they lose their hair or they have scarring, can you get your hair back if it's scarring?
Yeah, so when we talk about scarring alopecia, remember we're talking about damage to the hair follicles. So the ability to regrow hair after damage to the hair follicles is really going to be determined by how damaged those hair follicles are. And the lady that I showed with, the hair loss where she had almost all the hypopigmentation and very little hair, that's not somebody I'm going to be able to bring hair back in, because her hair follicles are so damaged. The pigment is damaged, the hair follicles damaged. We're not going to do that. But in those localized little patches, I've been amazed at these patients have chronic cutaneous lupus with discoid, what we think of as scarring lesions. We do injections, we do aggressive topical treatments, and sometimes, like I said, we do hydroxychloroquine. Some of those small little patches can regrow. And it really it depends on where you are in the spectrum. Unfortunately, we don't always know, and it's different for every patient.
Someone asked, do you see discoid lupus in the ear very often?
Yes, very often. It's that's like a little cheat area. Like I see it in the ear, I'm like, I know what you got. So yeah, it's very common.
Do you recommend a person with lupus-related baldness see a dermatologist regularly?
Well, I think it depends on what the goals are. If you have hair loss, I don't like to say baldness because typically we don't see people with complete baldness. Bald is a word we kind of avoid in dermatology, but hair loss, if you have a lupus-related hair loss and it's not being addressed, yeah, I think you should see a dermatologist, and then you'll work with that dermatologist to determine what your follow-up should be.
Is there a treatment that you may not be able to answer this because everybody with lupus is a little bit different, but is there a treatment for thinning hair loss with the medications that we're taking? For example, Nurse elixir vitamin formula, is this okay to take? I don't know what that is.
Okay, well, I'll tell you, there's a lot of things on the market, on the internet, Amazon, wherever you look, that are, the cure for hair loss. And, I'll tell you what the 3 things that you got to watch out for: the cure for hair loss, the cure for overweight, and the cure for no money. Okay, those are where you're going to get the scammers. So, and hair loss right up there with the money and the weight. So you have to be very, very careful. I am a big fan of eating nutritionally. And I think that if you take the food that you take in, is going to give you a lot more in the way of vitamins and support for your overall health than any supplement. Now, I do have several supplements that I do recommend. I work with the Nutrafol people, and you might have seen that on my disclosure side sometimes as a consultant. But that is the hair loss supplement that has micronutrients that I recommend to folks who are having issues with, say, hair breakage or just unhealthy hair, maybe some shedding. I don't think there's anything wrong with that as long as it goes along with all your other medicines and your doctor's fine. It's not a prescription. You can get it on the internet. We sell it in our office. So I think some supplements are reasonable, not all. And again, you need to talk with your doctor. And I saw that somebody just threw biotin in there. I'm going to answer that while we're talking because it's kind of along the same lines. Biotin does not help in any way with hair loss. Anyway, although it's all over the internet helping, it doesn't. And I would recommend you not take it because I used to tell my patients, well, it can't hurt. But now we know that biotin can alter the results of hormonal tests. So like your thyroid tests, if you had a heart attack, it can alter those tests, pregnancy tests. It's really not a good thing to take. It can work for nails, and sometimes we'll give it to people for nails for like about 3 months at a time. But for long-term, taking it for hair loss, don't do it.
Okay. Can hair loss also be seen in Sjogren's?
Sjogren's is kind of off the beaten path. I know people with lupus sometimes do have Sjogren's. If you have a flare of any autoimmune disease, I think that any systemic autoimmune disease, you can have hair loss associated with that. But I don't think that typically Sjogren's is associated with any particular form of hair loss. So I would say it's not typical. Again, this would be a situation where you need to go see your dermatologist and say, what do you think this is? And it may not be related, but you may have a hair loss form that needs to be treated.
There's lots of questions just about like over-the-counter shampoos or, what would you recommend if somebody doesn't want a prescription?
Yeah, so over-the-counter products, again, if you have itching or scaling in your scalp, trying things like zinc parathione shampoos, salicylic acid containing shampoos, tar containing shampoos, they can be helpful. They're not really treating the lupus, but they can be anti-inflammatory. So I think those are reasonable. They're good for your scalp. They're hard on your hair. So use them to your scalp and make sure you follow up with a nice conditioner because they're not really made for conditioning the hair. in terms of, you know, things that you can get that's going to really be helpful for the inflammation of the scalp, unfortunately, there aren't really things over the counter. Castor oil, coconut oil, you know, all these things. There's thousands of oils and butters and shea butter, and everybody wants to be natural. And a lot of those oils and butters will actually cause irritation in the scalp. So you have to be very careful. When people come and see me, I tell them, you only use what I give you. If you want to use something else in your scalp, you need to write me an email, you know, through your chart, and we can decide whether or not that's going to be effective, because I've seen so many people get burned with, you know, coconut oil and all these things that are quote unquote natural. But one thing, they're not regulated. Nobody regulates these over the counter products, and they have fragrance in them. They have all kinds of other unadulterated chemicals. So be very careful about that. Now, if you have a stylist and you like the stylist, you trust your stylist, and they're giving you things and recommending things, and it's making your hair look good and you feel good, that's fine.
Here's another question. I have lupus. It's not aggressive enough to have major issues on my skin, scalp, or joints. I have mild joint pain and some hair loss. And sometimes I feel skin eruptions in my eyebrows, mustache, and under the eyes. You mentioned that you suggested one of your patients get some chemical peeling. Do you recommend to get chemical peeling as a preventative approach?
No, I do not. So the chemical peeling for that patient was simply because she had scarring, hyperpigmentation from the process of the lupus. It was not in any way a treatment for the lupus. It was really treating the cosmetic outcome from the lupus flare. So what you're describing, though, is an inflammatory process. We don't treat inflammatory processes with chemical peels except for acne. That's the only one. So I wouldn't do that. I would see your dermatologist and just determine what it is that's happening. You know, it might be just something as simple as seborrheic dermatitis, and you may be able to get away with doing an over-the-counter anti-dandruff shampoo, a prescription anti-dandruff shampoo, or hydrocortisone. But I wouldn't try anything until you go in and check it out.
Can you talk about frontal fibrosis alopecia?
Oh, sure. Frontal fibrosing alopecia, also known as FFA. I actually had that in the talk, but I took it out of the talk because the talk was already too long. So the frontal fibrosing alopecia is a fairly new on the block form of hair loss. It was described in the mid-90s in Australia by dermatologists that saw it in postmenopausal women first. But now we've seen it and it was very rare. You know, I would see it once a year, you know, twice a year. Now I see it every week. And it is one of the most common forms of hair loss, and the incidence of it is exploding. We don't know what causes it. To date, we don't have any causal things to pick up on. It's not related to lupus, although I think somebody earlier said that they had both. It is an inflammatory scarring form of lupus that affects the frontal hairline. So you get recession of the frontal hairline. It just starts going back and back and back and back and back. And we treat it in very similar ways that we treat lupus, but it's really thought to be a variant of a disease called lichen planopilaris, which we didn't really talk about. So I don't want to get everybody confused, but yes, it's out there, another process, and we do treat that, and we need to treat it, but we don't treat it very well. To be honest with you, I think I treat lupus-related hair loss better.
What are your thoughts on the effectiveness of Nutrafol for hair growth?
Oh, Nutrafol. Yeah. So I just mentioned Nutrafol. So it is one of those, you know, micronutrient supplements that's out there. It's one of the ones that I feel comfortable prescribing recommending. I don't say I prescribe because it's not a prescription. I do recommend it for patients who have shedding of different types, who have breakage. It's not magical. It's usually an adjunctive treatment. In other words, I've got you on some main treatments, and then we add this. But again, this is very particular for what you need and for what you have, and it's something you should discuss with your dermatologist.
Does taking hydroxychloroquine contribute to hair growth?
Hair growth?
Growth, yes.
So if you're taking hydroxychloroquine as a lupus patient who has hair loss related to lupus, then your hydroxychloroquine will control your lupus and allow your hair to grow, allow your hair to regrow. So yes, it helps with hair growth, but it's not a hair growth agent. It helps because it's actually helping your lupus be controlled. So it's very different than a hair loss agent. It's helping because it's taking down the inflammation that's causing the lupus.
Can nutrition help with hair loss?
Sure. Good nutrition is always important. You know, I think there's nothing that you need to specifically eat or avoid. Again, you know, generally good nutrition, good, healthy vegetables, and good, strong proteins. You know, if you're a vegetarian, you got to get those proteins in, and fruits. You know, those are the mainstays of what your diet should consist of. You know, get rid of all the sweets and things like that that we don't absolutely need.
Let's see. Some of these I think you've already answered. Should I see a rheumatologist or a dermatologist with hair loss concerns?
Hair loss is always going to be dermatology. There's no doctor other than dermatologist, a board certified dermatologist, who's going to really get it. You know, certainly, as I said, we work very closely with the rheumatologist and or your primary care doctor, depending on what you need. But the dermatologist is going to be it. You can certainly start the process with the rheumatologist or your primary care doctor, but you're really going to need to see a dermatologist, particularly one who's interested in hair loss.
If my sister has alopecia and I have SLE, should we check her for lupus too?
If she has alopecia areata and has been diagnosed with that, I don't think there's any reason for her to be checked. I mean, certainly, you know, if she has other symptoms, joint pain, fatigue, weight loss, you know, whatever, these are the symptoms that you can have, sure. But if not, you know, I think it's just one of those situations where you have autoimmune diseases in your family. She has one, you have one, you know, so I think that's what that is.
Several people are asking, how can they get in to see you as a doctor?
Well, I'll tell you, anyone can come see me in my clinic at Wake Forest. I will say that for my hair loss clinic, we're booking out a year.
Wow.
So it does take a little while, but I'm happy to see anybody who wants to come see me.
Okay. Let's see. What does lupus cause your head to be tender?
Only if it's an inflammatory process going on at that spot. You know, I think I saw that there's this idea of being tender-headed, you know, where it's hard to comb your hair because everything just hurts. And there are some people who are just made like that. And I think their nerve endings are just really, you know, kind of active, you know, and it's just like anything, you know, some people are just made that way, you know, whenever you try to braid your hair or detangle it, you know, it's a little bit sore. If that's something you've had all your life, then no, it's probably not related to lupus. But if you have an active lesion of lupus in your scalp and it's tender, yeah, sure, I think it can cause tenderness.
When searching for a dermatologist, do you need to find one who specializes in cutaneous lupus?
I think it helps. We have a couple of dermatologists who like complex medical dermatology in our department, Dr. Joe Urizzo, Dr. Willie Wong, Dr. Lindsay Stroud, and they are extremely knowledgeable about all the rheumatologic diseases. And so I think it's nice to have that background. You know, there are many excellent dermatologists who really don't do the complex medical derm. So you should make sure that when you call the office, you ask if that's something that they feel comfortable treating.
Great. Can we color our hair? And if so, what product should we use?
Yeah, I think if your hair shafts are normal and they're healthy, there's no reason you can't color your hair. And I would defer to your stylist. I'm really not a big fan of people doing their color at home, you know, unless you're someone you live with as a stylist. I recommend getting it done professionally. And whatever products they use and are safe for your hair would be fine.
So another question about hydroxychloroquine. It does not cause hair loss, correct?
No, I've not seen that to be the case.
Okay. I've been complaining about hair loss to the wrong doctor. I should be telling my dermatologist instead of my rheumatologist, right?
Right. That's right. People tell me about their joint aches and I tell them to call the rheumatologist, and people talk about their hair loss and they tell you to call the dermatologist. So yeah, we share.
Wigs are so expensive. Do you know of any resources for health issues, people who have health issues that need wigs?
Yeah, so there are many insurances that will cover wigs. I usually write it as a scalp prosthesis, and I use the the diagnosis code for the problem, you know, so if it was lupus, I would use the diagnosis code for SLE or chronic cutaneous lupus or whatever it is. And a lot of insurances will pay up to, you know, $400 even for wigs, you know, similar to the way they do it for chemotherapy. Now, of course, not all insurances do that. And I don't know, other than for children, you know, with Locks of Love and the National Alopecia Areata Foundation, where you can get a whole lot of resources for that. But, you know, there are so many hair wig, like wig places around now in most big cities, especially, and even in our small cities here in North Carolina, you can get a really nice looking wig for like $50, you know, but you can't try them on right now, usually COVID times, but you know, 45, $50, you know, if you can't try it on, you can try it on and get home and you're not wasting a lot. But you're right. If you go get one of the really nice, you know, sort of human hair wigs, they're going to run you a little higher than that. But I suggest you kind of look around.
Someone's asking if if my lupus is under control, you know, I'm not in a flare, but could lupus still be causing scalp and hair issues even when my SLE is under control?
Well, you know, if you have scarring hair loss associated with lupus, it's not going to go away when you're controlled. So unfortunately, the scarring forms of disease will cause the thinning, and it can just kind of stay that way. And I've also seen people who have had a lot of diffuse loss with lupus and they don't ever kind of regain it. And I suspect it's because there's probably some scarring in there too. So there are, you know, variants of every type where, you know, if your lupus is not active, you know, all your hair will come back and it's great. And it's on a continuum all the way up to the opposite. So it's really very specific to the person.
There's still a lot of questions just about supplements and vitamins and, you know, anything in particular that you're recommending. Okay.
Nope. You guys got to get out of that vitamin. That's going to turn you wrong. You're going to be chasing the vitamin down the road and it's never going to help you.
And you don't even really know if what says that's in there is even in that vitamin.
Correct.
I mean, they're not really regulated. So
right. So that's why I stick with the Nutrafol. Some people like Viviscal. I mean, again, it's not really a lupus specific thing. It's more like a micronutrient. And I think those are reasonable to try. And if you do try one and so they're not truly vitamins, they're nutrients, then I would try it for about 6 months because it takes about that long to see if anything's going to really work.
Okay. Do low vitamin D levels affect your hair?
Probably. You know, we don't have specific data, but if you have low vitamin D, it's always recommended to get it up to the normal level, because not that vitamin D has a direct, you know, tie to the hair, but because it's used in so many other, you know, different things that go on in your body, it can, you know, help just move things along and have more healthy hair. So I would say yes, take vitamin D supplement if you need it.
Can you spell Nutrafol for everybody? They're asking.
Nutrafol.
Okay, thank you. My skin is dark brown. Discord has left me with all pigmentation gone on my nose, under my lip and ears. They're all just pink. Can that pigmentation come back?
Not typically, you know, unfortunately, again, that was where the white blood cells damaged that pigment. And so if you catch it early, sometimes we're lucky enough to get it back. But it's not like vitiligo where we can start using light therapy and things like that. You want to stay away from light therapy if you have lupus, because sometimes sunlight and those sorts of things can make your lupus flare. So in those cases, you know, things that you can talk about with your dermatologist are things like Dermablend makeup, which, you know, you can match to your color. I'm sure you probably worked through that. And there are some micropigmentation processes that you can do these days now to kind of match your pigment. Those are hard to find. I don't do it, but some people do it in the US, and it can look very, very nice. Again, you have to make sure you don't have active disease, because I would never treat somebody with active disease with micropigmentation, but that is somewhat like tattooing, but it's a little different.
Okay. I'm not going to pronounce this correctly, is Revlimid versus phthalimide. Which one's better for
Oh,
cutaneous?
okay. Yeah, we rarely use Revlimid for cutaneous lupus. It's mostly thalidomide, ethalamide, and so yeah, that's just sort of a thing about dermatologists. We're kind of on the thalidomide side of things, but in terms of what's better, if you need it for other things, that I wouldn't be able to tell you. I can only tell you the skin stuff.
Okay.
Mhm.
What about chronic anemia and hair loss?
Yeah, I mean, anything, like we talked about, that telogen effluvium can really be from a lot of different things. Thyroid disease, chronic anemia. I mean, you gotta get all the parameters normal. You gotta figure out why you're anemic, number one, and then, treat that. And that's something that you and your primary care doctor or your rheumatologist can work on. But yeah, all that can play a role.
Are there any clinical trials taking place for people with lupus and hair loss?
Not that I know, certainly not at our site. We don't have any, that paper that I talked about was taking place, that research took place in Thailand. I'm sure there are people doing lupus research. You can certainly always check clinicaltrials.gov and see what's out there. I don't know of any in my area or even that are active right now, but people start up new things all the time and they don't ask my permission. So you can find out on clinicaltrials.gov.
Okay, we're getting a little past 7, so I'm just going to ask a few more questions.
Okay.
Is CBD oil recommended for scalp inflammation?
Yeah, so CBD oil is, one of the big question marks in dermatology. There's very little data out there, very little research out there, really for any form of skin issue. The most that I've seen written about it has been for itching or pruritus of the skin. And there's not a whole lot of data even about that to support or refute the need to use it. So right now, I'd say it's very investigational. There's not a lot of data, and that would be something you need to talk about with your doctor.
Okay. Does Imuran contribute to hair loss? I mean, there are a few questions about specific drugs that cause hair loss.
Yeah, so some of these other, like hydroxychloroquine, no. Imuran, maybe. Methotrexate can. Cytoxan can. So some of the more, strong drugs can cause it. And there you have to weigh whether you need that drug, because if you need that drug, you need to take it. And then weigh that against whether or not it's really contributing to your alopecia. So that's a question that I think is left up to how important is it that you stay on that drug, and can we do treatments while you're on it that kind of maximize the hair you have and the health of the hair that you have, despite the fact that you have to take that.
If you can afford hair transplant, do you suggest doing that?
No, I don't, because in order to do hair transplants, you've got to have great hair donor areas. And we never know where lupus lesions are going to occur. And so if you take lesions out of an area, it could be then that the donor area is affected by the lupus later on. So while the general answer is no, I have patients who have burnt out lupus. They don't have any, and they only have like a very small area that's affected. And one of my colleagues in Chile does hair transplants on those patients all the time. But it's really for people who have burnt out areas. They're stable for 2 years at least on medicine, and willing to stay on medicine, and then they may be able to get hair transplants into a very localized area. But when you have a large area, no.
Several questions again about other issues causing hair loss, like thyroid issues. Does that cause hair loss?
Yep. That's a whole nother story. So, high thyroid levels, low thyroid levels. Thyroid is one of those things where we see, that telogen effluvium hair loss, that kind of diffuse look, hair loss that we talked about. And that form of hair loss, when you have thyroid abnormalities, Sometimes when you lose that hair before you've gotten your thyroid organized, it's hard to get that hair back. But if it's early enough, some people will regain their hair. So thyroid does it in a lot of different ways. It's a little bit more than what we can probably address today, because that's a whole nother story. But that telogen effluvium is going to be the most common form of hair loss we see in thyroid.
Okay. I think that will conclude all the questions. I'm sure, you know, if you have something specific, you should speak with your dermatologist or your rheumatologist about that. We got through a lot of questions though, so I appreciate that very much. I'm sure all of you, you know, there's a lot of comments here thanking you and saying that this information has been very helpful. So thank you very much. And thank you all. Thank you all for attending this evening, and look for future programs coming up soon.
Bye.
Good night, everyone.
Have a good night.
Thank you.